Hi, Dr. Chris Campbell here. You know, I get a lot of patients when they come in and they're very impressed with the labs that I do, and that's most functional medicine or integrative physicians do. This is the usual, typical, comprehensive lab report that most mainstream physicians get. And basically what that's comprised of is a CBC, a comprehensive metabolic panel, and a lipid panel. This is an example of what most functional medical providers get initially when they first see a patient. As you can see, I've blackened out or I've whited out all information from the patient. However, not only does this give such a larger amount of information, but it also, for the patient's sake, gives the answers or their results in color codes. You know, green for good, yellow for in between, and red for bad. I'll go into detail later in a series of videos that actually get into depth with the different types of labs, but in a gross overview right now, I'll show you this here is a typical lipid panel, and this is the lipid panel that most physicians get in what I call mainstream medicine. However, unfortunately, about half of the population that has heart attacks or strokes can have a normal lipid panel. So the researchers, cardiologists, such, they got together and they took blood samples from all of these people that had a heart attack or a stroke, and they said, well, let's find out what they have in common. And that is where the second section came in, and also the third section. And this is a lipid lipoprotein analysis, and these are inflammatory markers down here. And as I said, I'll go into more detail in later videos. Additionally, what I want to do is I actually check if I want to see how somebody's heart's actually working. Is it working hard, or is it just cruising and having an easy time of it? And these markers here tell me how someone's heart's functioning. Is it if they have heart failure, if they've had prior damage to their heart, etc. Down here is some genetic testing that I do. This actually is what we call the Alzheimer's marker, but it also helps to tell whether somebody's a good candidate for statin therapy or not. And down farther is other markers that have to do with methylation, uric acid, vitamin D status, and CoQ10 status. Most functional and integrative physicians will actually check vitamin and mineral levels too. So, on the next page, I actually check renal status, and this tells me how someone's kidneys are functioning. And again, I'll go into more detail in later videos. On the next page, I actually want to check to see if someone does have high cholesterol. Do they have high cholesterol because they're absorbing too much cholesterol, or do they have high cholesterol because they're producing too much cholesterol? Because if you find that out, you can really treat them a lot more accurately and target the treatment. So, and honestly, most of the time, they do not need statins. I also check for celiac disease. These are tests that tell whether someone is sensitive to gluten and if they should not be eating gluten. On the following page is actually an allergy for wheat, so it tells whether they're actually allergic to wheat or not. This individual was not. So. On this page, this is actually, again, very color oriented for the patient, but I not only check glucose, but also check for insulin resistance and for beta cell dysfunction. And beta cell dysfunction is just looking at sugar metabolism and throughout the body at the level of the pancreas. On the next page, though, is actually all the numbers that go along with this. Now, most physicians will just check the very first marker here, which is your fasting glucose. And if that's high or above 100, then hopefully they'll check an A1C. But that's usually it. And unfortunately, you can see here with this individual, his actual sugar is pretty stable, and his body's been able to keep his sugar under good control. However, he has quite a bit of insulin resistance and beta cell dysfunction, which means guess what's coming? If nothing's done at this point, down the road for him he's looking at the likelihood of diabetes. So if you can see this far, if you can see that far down the road, then you can avoid things, and that's exactly what we're doing with this individual. On the next page, this has some of the things that are pretty typical on the regular mainstream medicine lab, including electrolytes and liver function, renal function, but I also check a ferritin level, which is an iron storage level, which is good to know for numerous reasons, and we'll also get into that later in a different video. Protein status, thyroid status. Unfortunately, most physicians will only check a thyroid stimulating hormone, or a TSH, which is an indirect feedback test, and they're not checking direct thyroid studies as I do here, and as most, again, functional or integrated medicine providers do. I also check on all of my new patients and anyone that's on hormone replacement therapy, serial hormone testing. So I check the sex hormones such as DHEA, estradiol, sex hormone binding globulin, testosterone total and testosterone free. And if I didn't mention estradiol, that's on there as well. On the next page, I check insulin-like growth factor, which is an analog for how well one's growth hormone is doing in their body. And again, down at the bottom of pregnenolone. So, on the next page is more of a comprehensive analysis of renal or kidney function. The next page of this is done by most physicians. It's a CBC, which tells us whether someone has an infection or they're anemic or lymphoma, etc. A CRP is also done to see what kind of inflammation is going throughout the patient's system. On all men, I check a PSA level, and I do that serially at every check if they're on hormone replacement therapy. And then the last thing on these initial labs is an omega-3 index, which tells me what the fatty acid balances are doing in the patient's body. Extremely important. So, anyway, as I said, we can go over these later in more detail. But for now, I just wanted to compare the two, and that's it for now.